Hello, good evening, everyone. J Mariah 001 here with you with a little tidbit of facts about a mental illness, borderline personality disorder. And I have a paper here from NAMI that has some facts about borderline personality disorder, or BPD as it's called for short. I'm just going to be reading it off to you here because I don't have all of this memorized, so reading it would be easy, I guess, easiest thing to do. Alright, well, here we go. Borderline personality disorder, BPD, is a devastating psychiatric disorder that centers around the inability to manage emotions effectively. The symptoms are fears of abandonment, impulsivity, rage, bodily self-harm, suicide, and chaotic relationships. Officially recognized in 1980 by the psychiatric community, BPD lags behind many severe mental illnesses in research, treatment options, and family education. While some persons with BPD are high-functioning in certain settings, their private lives may be in turmoil. Others are unable to work and require financial support. Estimates are that approximately 5.9% of adults, approximately 14 million Americans, have BPD. Suicide and self-injury in adults. 10% of adults with BPD complete suicide. 55 to 85% of adults with BPD self-injure their bodies. And 33% of youths who commit suicide have BPD symptoms. Treatment challenges. Research-based therapies for BPD are not widely available. No specific FDA-approved medication exists for BPD, and BPD regularly occurs with other illnesses, e.g., 60% also have major depression. A 30-year-old woman with BPD typically has a medical profile of a woman in her 60s. Treatment. In the past few decades, treatment for BPD has changed radically, and the prognosis for improvement and/or recovery has significantly improved. Hospitalization is most often restricted to the management of crises or medication changes, if monitoring is needed in a controlled environment. Psychotherapy is the cornerstone of most treatments of people with BPD. The standard recommendation for individual psychotherapy involves 1 to 2 visits a week with an experienced clinician for a period of 1 to 6 years. Two types of psychodynamic therapies have now been proven effective. 1. Transference-focused psychotherapy, TFP, emphasizes the interpretation of the meaning of the patient's behaviors within relationships, most notably the relationship with the therapist. TFP also emphasizes the importance of experiences of anger. 2. Mentalization-based therapy, MBT, emphasizes the value of recognizing one's own mental states, feelings, attitudes, and those of others as ways of explaining behaviors. Dialectical behavioral therapy, DBT, combines individual and group therapy and is directed at teaching the borderline patient skills to regulate intense emotional states and to diminish self-destructive behaviors. The core of DBT is the concept of mindfulness, which involves awareness and attention to the current situation. In addition to mindfulness, DBT addresses regulating emotions, distress tolerance skills, and effective interpersonal skills. Cognitive behavioral therapy, CBT, requires the patient to scrutinize and challenge core beliefs which adversely affect self-perception and ways of interacting with the world. Family therapy and group therapies are helpful when the patient is motivated to listen and communicate with others, rather than actions. Despite its prevalence in clinical settings and its enormous public health costs, the disorder has only recently begun to demand the attention it requires. Parental advocacy, education, support groups continue to form. Our understanding of the disorder is in the process of dramatic change. Many patients do get better. So that was just a little information on borderline personality disorder, a paper from NAMI, Family to Family Education Program, that I am currently attending. Yes, I have a family member with with borderline personality disorder, and it is a difficult mental illness to live with a loved one with it, but you do the best you can from day to day, and that's about all you can do. Anyways, I thank you for listening and watching my video, and I hope that it was a little bit of educational piece for you. Okay, thank you for listening and watching.